So I'd like to welcome Martine van der Merwe and Lourens Dijkstra. I thank you so much for taking the time to join us and actually to talk about interventions. If I understand it correctly, not only do you have success stories to help us, but you're going to help us understand what, as James has just said, how we have that impact on the people that we're trying to help reduce risk amongst, and of course, interventions, a fancy scientific way of describing it, quite fitting given your healthcare backgrounds and healthcare settings right now. So we're looking forward to hearing from you, looking forward to you describing a little bit more about yourselves as you go. Over to you both.
Thank you. Well, I'm very excited to do the dual presentation with Martine today at your Sound Summit. And we love to share the outcome of our journey for looking for how to choose effective interventions for information security behavior. But before we start, I'll take you to an incident we had last March. One of my colleagues, John, he received a spear phishing, and he was asked for help. It seems like it was from our financial controller, and his phone was out of order and he wants to help. And John replied to him and said, well, how can I help you? And the person asked him, well, can you buy some phone cards for me? Yeah, send them by an email. And so John noticed and realized this wasn't real, the financial controller. This must be a phish. And he felt a little bit confused and stupid, and he decided to delete the phishing email. So far, so good. Yeah? The organization wasn't harmed. But what's missing? As Lentis, that's a company where I work for, we want to, all our employees have to recognize phishing emails and have to report it to the service desk. And that was missing. Yeah? John didn't realize it was a phishing email and he didn't report it. And normally we ask for our supplier to give us an update of our e-learning program and write a blog on the social intranet. Well, so far, so good. But are we sure if these are the real interventions? Are they really effective? And we're not sure. So I asked some of the 15 people who received the spearfish, and most of them recognized the spearfish, but only 2 of them reported to the service desk. And they told me, well, it took too long for calling the service desk, and that's why I didn't report it. So that gives a point that, well, if we have to better the reporting behavior, you have to do something else instead of only support them and hand them over to a phishing e-learning program. And think about what will you do in such a kind of situation. Even if you go, and then the next slide, please. Even if we know, as Gartner mentioned in their report of 2020, there's 700 million worldwide turnover about only computer-based training. So wouldn't it be great if we know our interventions are effective? And by the way, do you know how much will you spend on security training this year? Next slide, and let's introduce myself. This is me. I work as a Chief Information Security Officer at Lentis, and before I worked as a consultant at Philips and KPMG and Q at cybersecurity. My educational background, I'm a psychologist, and for more than 10 years, I worked at the cutting edge of information security and behavior change. And in my free time, I love to run marathons, and I like to do some fundraising for charity. And I'm not alone, I do it with Martine. Next slide, please.
Hi, everyone. My name is Martine van der Merwe. I'm the founder of Privacy Lab, and I'm based in the Netherlands, Europe. And my drive to do this work is I'm really concerned about the emerging lack of privacy and the possible disruption of our society due to information security incidents. And after working some decades in IT development, IT advisory, and IT audit, I realized the importance of the human factor. So in 2015, I founded Privacy Lab to help healthcare organizations with data protection with a focus on human risk. Now, we are going to share, next please, our findings from our project. And we start with 3 problems. And these problems may not apply to you all, but I'm sure our findings are relevant for all organizations. And as mentioned in other presentations, I start with a confession. Oh, I'm aware of a lot of things, but well, if I have chocolate in the house, I'll eat it, although I'm aware eating healthy is better. So my awareness doesn't necessarily lead to changing behavior. Please click and twice. And what do you think of my security awareness? I'm aware I should use multi-factor authentication whenever possible, but I don't do that all the time. So awareness isn't enough. It's behavior that counts for security. We jump from awareness to behavior. Our goal is not to raise awareness. Our goal is to change behavior. The second problem, next please, we're talking about is the way we choose interventions. Interventions are often chosen on gut feeling. Think about John, Lourens told you about, and the first idea is to choose for an e-learning. But although chosen with good intentions, there's often a misfit between the interventions and the needs and preferences of the people. Our goal is to offer engaging, our goal is to improve information security, and we do that by engaging interventions. And well, maybe you recognize these, and please click along. Classroom training, posters, escape rooms, etc. Please click more times. Escape rooms, newsletters, and games, etc., etc., etc. And I don't say that's the problem. The problem is, next slide, please. Time and money are spent while we don't know the result. The effect of the intervention is unknown. Please click one more time. Yeah, thank you. So how do we know if our money and time are spent well? And it's not only our time, it's also the time it takes from the target audience. So it's necessary to know the result. And if you know your interventions work, that's great. And you can show your results. And if you know they don't work, that's also good to know because you can adjust them. So next, how did we start? I'll tell you a bit about our journey. After a number of incidents with patient data, the Dutch Parliament ordered the Minister of Health to do something about security awareness in healthcare. And a project was commissioned by the Ministry of Health and the employers in healthcare together. And you can see their names in the footer. And the project is executed by ICTU, a non-profit organization working on a better digital government. The project is focused on healthcare, but our findings and products are relevant for all organizations. And it's non-profit, so the products are available for free. Next, please. The project started and we focused on behavior rather than on awareness. We included security professionals in our team, but also behavior and change experts. And we used the scientific behavior change wheel by Susan Mickey. We adjusted it and we customized it, and we started 4 long-term pilots in healthcare organizations like a hospital, a university medical center, a nursing home for disabled people, and the organization Lourens will tell you more about later. And the human risks we covered in the pilots were issues like phishing, sending confidential information to external parties, and unauthorized access to confidential information. And we developed a 6-step approach, structured approach, and we put it in a roadmap. And from here, we're going to share the roadmap with you. And the roadmap will be available in English for you all. Next, please. The first step, I'm going to tell a little about the first steps. Of course, every step in this roadmap is important, but we're going to focus on the key steps, the steps that make a difference. But for you to have an overview, I'll introduce the first two steps shortly. And the first step is preparation. Please click. In this step, you select the human risk, you put together a team, and you draw up a plan, which may have a lot of holes. You fill it as you go. And here we have our first lesson learned. Please click. Team up with the right people. And like many lessons learned, this may sound really obvious, but as you want to get started right away, it might happen. In one of our pilots, we started with just security people. And of course, we were missing people from the process, people who knew the process, but also other competencies like advising, communicating, interviewing, people to get funding, etc. So here again, the lesson learned was team up with the right people. Now, the next step, please, that's select target behavior. And this is often overlooked. Target behavior is the behavior you want to see in people to solve or reduce the problem. What exactly is it you want the people to do? And Lourens will give an example of target behavior in the rest of his talk. He starts with the next step.
Thank you. Please click twice. Thank you. We have research for over more than 1 year and in the pilots, and one of the pilots I will zoom in and take you with the outcome. It's at Lentis. It's one of the 4 pilot organizations. It's a mental health care, an elder care and forensic health care organization. It's in the top of Holland. It's about 125 years old already, and with 4,000 employees are working with Lentis. In the beginning, I started as an external consultant with this project, and the 1st of January, I came over to the Lentis family, and it's a great place to work as an internal consultant. Next slide, we have to practice our roadmap at Lentis, and it's about the problem. And please click. So Lentis, we had in 2020, we had a problem about the electrical visiting unauthorized at the electrical medical records, like EMR. And it was a minor of the audit. As the audit in NEN 7510, it's similar like the ISO 27001, but the NEN is specifically for the healthcare organization in the Netherlands. So this was a problem, and because there was a risk about misuse of information, because they weren't unauthorized, and in Holland there was a big fine for looking at EMRs of celebrities. So this was a problem for the board of directors, and we get started with this issue. And if people are looking for the EMR and they are not unauthorized, they can use an emergency procedure. And then they have to fill in what's the reason why they are visiting the EMR. So this was a problem for the board of directors. We have to always have to justify the reason. So click twice, please. And we formed a team with Lentis, with a security officer, privacy officer, a functional administrator, a business intelligence consultant, and then we started with the team. And we discussed about the problem, and we came to our target behavior. What is the desired behavior of the people? They always have to justify the reason if they visit unauthorized the electronic medical records. And that we went to the step 3, please click. Oh, sorry, forgot the lessons learned. So this is very important. If you start a project like this, you have to have start with an urgent and important problem, and you have the full commitment of the top management. Please click again. Let's go to the next step. It's about examining the behavior. You have to go at the workplace, look around, talking with a lot of people, and let's see how it went with Lentis. Please click. In Lentis, we applied the COM-B model. As you see, the right side, the behavior, and at the left, the 3 factors who are influencing the behavior. Let's start with opportunity. People have the opportunity to do the behavior. They have enough time. They have to be, the behavior has to be social acceptable, and also the behavior of the peers and the team leads are key. Motivation, are they really motivated to do the behavior? It's important. And also about capability. Do they have the knowledge and also the skills to fulfill the behavior? Well, please click. So this is the behavior, and we started by interviewing about 10 psychologists, some team leads, some secretary people about the behavior. Now please click, and let's see what's the outcome. The outcome, this wasn't an issue at a team meeting for the people. They said, oh, I didn't know it was a problem. They never told about it. Please click. And also they said, well, I've never had feedback from my team lead. Please click. It seems a little bit redundant. Well, if they want to know what I've done, they can look at the AMR, what I've done. But on the other hand, please click, is they felt very, okay, it's very reasonable to justify. That's no problem. Oh, okay, if it's a good thing to do, I will do it. Please click. And about capability, they have very little knowledge of guidelines. They weren't aware there were guidelines to use. Please click. And this is very typical. They were not aware it was an emergency procedure. So they thought, okay, how do I get to the EMR? Okay, we can use this road. And let's see about the next step. So we knew the outcome, and we go and to step 4 and 5. And for this talk, we make a combination. What will be the interventions to make sure you stimulate behavior and take away the thresholds for the behavior? And please click. Let's see what we've done in Lentis. And this is the moment you have to start thinking about interventions. Not before, now. So look at the interventions we took place. Please click. We made an infographic for all the employees so they are informed about the situation, of how much they've used and how much we are, if we are on target. It's quarterly presented at our social intranet. Please click. And the team leads we spoke, they said, well, we don't have steering information to be aware what is the situation in my team. So we made for them a dashboard. And please click. And this was the input for the team meeting. They talked about their situation in a team, and they discussed, well, why I'm using the emergency procedure, and perhaps we can change the authorization process. Please click. And like Martine told us already about the behavior change wheel, we added an extra action. If you want to have sure if these interventions are effective, you have to measure them. So we added an action of measurement. Well, let's look at Lentis. Please click. We measured with the start, and this was the absence of target behavior. So 14.3% didn't do the right behavior. So you can say, well, 85% already did, but we are ambitious. We did the interventions. Please click. And start again with the second measurement. And these are the outcome. Please click. And it's about 9.9. So, okay, we are on the right track, but we're not satisfied perhaps. And we can measure all the times and do it several times. Every month it's measured. Please click. And let's zoom in about our monthly measurement. It's in 2020 and 2021. And you can see it's going downwards. And we are on the right track. And please click. And please click again. In October, we started with the convene and did some interviewing, did some communicating about the project. And the 1st of March, we started with the interventions. So it's going down, right track, but our ambitions is 5% at the end of this year. So work in progress. And now we go on with the 6th step. Please click.
Yes, and with step 6, we're going to finish the roadmap. This is the step to make sure the results last in your organization. So typical activities in this step are embedding, transferring, and reporting. So next, please, because there we have the result. This is the roadmap we developed. And I know this might look a little overwhelming, but in fact, it's just a visual representation of the steps we just went through. This approach leads a team step by step through the process. And the roadmap and the instruction manual provide tips, examples, and formats to get started right away. And the roadmap will be available in English. The instruction manual is just in Dutch. So maybe if you read Dutch, you can use it, or you use Google Translate if you want to know more about it. And here we have another lesson learned. Please click. It's hard not to take action immediately because action always is valued in organizations, and action makes you look good. But I'll give you an example from our project. After we finished the roadmap, we were so excited and we wanted to everyone make use of our roadmap. So we almost fell into the same trap. We thought we knew what CISOs and awareness officers needed to use this roadmap, and we came up with a lot of interventions. And just in time, at that moment, we realized it's a behavior change, so why not use our own method? So we started from the beginning. We had interviews with the target audience, and together with the target audience, we developed other interventions than what we thought of at first. So be like a doctor, do not treat immediately, start with an examination. And of course, in emergency cases, this examination can be very short. So next, please. It's time to wrap up. And the first point, next, is what stops people from behaving securely? Is it motivation? Is it opportunity, or is it capability? Use behavioral analysis. And then second, please, use those insights to choose effective interventions. And this is the most important point of our talk. It's different from other treatments. Use the behavioral analysis and develop your interventions together with the target audience, and that makes them spot on. And third, of course, check your results by using metrics and tweak your interventions until you succeed. And this method is based on starting small. And although you start small, the impact will be much bigger. And the benefit is your information security will improve because your interventions are effective. So now you're ready to start your journey. Next, please. And it might be a lot. So we made a little to-do list for you. So first, download the roadmap. And second, take some time to study it and study all the steps. Then choose your human risk and start your journey. And please keep it small. And if you need any help, reach out to us. We are, you can find us on LinkedIn or in the SENS community. Next, and it's easy to spend your money on products off the shelf. But keep in mind, lack of knowledge often isn't the problem. Be curious to find out what drives people to do what they do, and use those insights and metrics to manage your human risk. And we end, next please, with a quote of Karin, privacy officer at one of the pilot organizations. And Karin says, previously interventions were chosen on gut feeling. They were not measured, it was just what I thought that would work. From now, the roadmap is our guideline for choosing interventions. And we hope it will be yours too. Thank you.
Thank you so much, Martine, Lourens. Thank you so much for that. That was absolutely brilliant. Absolutely brilliant, because one of the things that you have just done there in the most eloquent of ways is helped us realize the importance of being specific and being targeted and being and measuring the effectiveness of interventions. I mean, so clear, and I'm so grateful. In fact, I can see from some of the comments that are being made in Slack and some of the comments that are coming in on other channels as well, that other people are too. We do have some questions and we've got a bit of time, so if you don't mind, maybe we can dive straight into that. Jess, maybe if you and I just fish out some of the questions that are being asked. And one of them, if I can throw this one up from Torben, is what surprised you on this journey? Martine and Lourens, quickly, what surprised you on this journey?
I didn't understand, sorry.
The question I think that has been asked there is, what surprised you on this journey?
Oh, what surprised us? Oh, I can give many examples, but the most surprising for me is we did it with some more organizations, and when the CISOs, etc., go to the work floor and talk to the people, they are always surprised. They have no idea of how people are working. And then they were surprised about their own surprise, because they said, I didn't know that. I'm going to talk more often to the work floor. And it's so easy, but it's often not done.
Yes. And perhaps I can add something what surprised me, that when we asked the people, what are your desired behavior? And it took very long to give them the answer. So it's very important to be aware, what do we want our people to do? So that's what's surprising me in the projects we have.
That's really interesting. And I have to say thank you so much for that presentation. I really enjoyed it, took absolutely loads of notes, and it was perfect for the theme of this summit in terms of managing human risk. And that last quote that you shared in terms of, before I was just doing what my gut told me. I was just doing what I thought was right. And now I have a structured way of doing this so that I can use targeted interventions to actually have an impact. And we're seeing so many comments along the same lines in Slack, in the hallway. So people really appreciate it. I personally was very excited about this because, Martine, you may remember when I first saw you speak at SANS Summit years ago, it was like a light bulb moment for me. And so I was really excited to hear from you and Lourens today. Brilliant presentation. Quick question I have, you mentioned the roadmap, and I know, seeing the comments, everybody's interested in getting a copy of that. How did they download that?
Well, I can put it in Slack right away, and I think it will be on the SANS website as well. And we have an account at LinkedIn with the project, but what we share there mostly is in Dutch, but there it's also. But otherwise, if you can't find it at SANS or in Slack, reach out to us and we'll send it.
Well, you're inspiring a few people to learn Dutch because they want to be able to read more about it. So that was great. Another quick question is, how do you choose the risk? You said, pick a risk and start small. How do you choose that risk to focus on?
Yes, it has to be the risk. It has to be very important. Like I told us, it has to be on top of mind of also the directors. It has to be just a small piece. Well, you're interested as a CISO. You have to get along with the top management. Well, what shall we take care of? So then you are also get the support for funding and resources. And it's very important.
Mm-hmm. So good. Yeah, and we elaborate a little on that in our instruction manual, how to do that. But alas, that's just in Dutch.
That's more inspiration to learn Dutch. Yeah. Lekker. Dank u wel.
Yeah. Yes, now you're showing off.
You learned that from Lens, I suppose.
As you speak.
I'm afraid I can't say any more, really.
Okay. Well,
but
we'll
maybe
help.
by this time next year.
Yeah, we will be happy to help anyone who reaches out to us.
That's fantastic.
Yeah.
And Lourens, thank you, both of you. This has been fantastic. It's been so good to hear from you. So good to hear you again, just continuing with this theme and helping us understand how practically you are applying what is evidence-based interventions, and then of course measuring the effectiveness of those interventions. Really, really good. And we do hope you stay and chat. There are people in your hallway talking about you, keen to talk to you, and of course really keen to see some of those resources you said that you're going to share as well. But thanks again, brilliant talk.
Okay.